Next on Imágenes, New Jersey Kid Care. Saludos, I'm Miguel Perez. An estimated 250,000 children have no access to the benefits necessary to obtain quality health care in New Jersey. But the State Department of Human Services is changing all of that with NJ Kid Care, a unique and valuable program geared toward improving the quality of life for children in low-income families. Joining us in our studio are Michelle Wolski, Executive Director of New Jersey Kid Care, Dr. Rodrigo Cárdenas, President of La Salud Hispana Incorporated, and Barbara Carriño, who heads a New Jersey Kid Care family. Welcome to the program.
Thank you.
It's a pleasure having you here.
Thank you.
Tell me, Ms. Wolski, why was the program created and when was it created?
Well, first of all, we're delighted to be here and thank you for the opportunity to talk about one of New Jersey's most newest and exciting programs. About a year ago, we've recognized the fact that there are many, many kids that do not have access to health insurance. So Governor Whitman, because of a federal law, initiated the NJ Kid Care program back in December. She signed the law, and we started enrolling children in February of '98. The program is designed to provide health care coverage to thousands of uninsured kids in New Jersey.
And obviously a lot of people are not even aware that it exists. Why is it so important, Dr. Cárdenas?
Well, obviously in the Hispanic community in the state of New Jersey, the uninsured children is around 30%. And in this community, we do lack that health services, and this is an excellent opportunity for Hispanic families to go out there and enroll their children so they can have access to the medical service that we need and access to immunizations and healthy children. So it's a very, very important program.
But as someone who is out there in the community, is our community aware of Kid Care? Or are they just beginning to find out about it?
Our community is beginning to find out about it, obviously through the great effort that the state of New Jersey is making through the publicity, through the translation of all these materials into Spanish. We have gone a long way, and we're trying to make this information more basic to our community so they understand that this is not a welfare program, that this is a program for working parents who cannot afford health insurance, and this is an excellent opportunity of a lifetime to insure our children and have healthy families.
Okay, Barbara, how do you benefit from the program?
Well,
you have a son, right?
Yes.
Was he insured before?
When I was working, yes, but I'm not working right now. And yes, it has helped because I had no coverage for him.
How old is he?
A year and a half, 16. So it's very important to have coverage for them at this time. They're into sports, they're into everything. And I feel that the New Jersey Kid Care was very, very helpful for me.
How did you find out about it? How did you get involved?
I found out through my sister. My sister got me involved in it, and she said give them a call. And since I gave them a call, they were very helpful in enrolling me.
So once you find out about someone like like Barbara, how do you deal with that? I mean, who qualifies?
Well, the qualifications, children 18 and younger qualify. The families have to have income within certain guidelines. For example, a family of 4 could make up to about $34,000 and qualify. The child does have to be uninsured. So those are basically qualifications. We've made applying to the program very, very easy. We have a toll-free number. We do a mail-in application, so families don't have to take off from work. They don't have to do a face-to-face interview anymore. We've eliminated a lot of the barriers to applying to state programs. We have a lot of work to do, but to date we've enrolled about 30,000 kids, so we believe we're off to a great start, but we know there's more to do.
And so if you have enrolled 30,000 kids, do you have any projection as to how many there are out there who still don't have insurance and who still need your program?
There's about 100,000 children that may qualify for this program.
So you got 70,000 more out there?
About 70,000 more. The good news is, though, in addition to doing an extensive outreach and a media campaign that covers newspapers, radio, public TV, we've hit every media you can think of, and we've developed a lot of partnerships. Actually, Dr. Cardenas has been one of our friends from the very, very beginning, because we do understand that there's a large group of Hispanic uninsured kids out there. So we wanted to start building partnerships with community-based organizations where families can go, they're trusted they're trusted in their community, and they believe, and that we have to get over some of the other barriers that families are facing.
Language, another...
Language is, you know, an issue. Everything that we do have is in English and Spanish right now, so I mean that has addressed one of the language barriers. And again, just, you know, developing partnerships with certain organizations, I think has been very helpful to us.
But how does it work? Who actually insures the child? Is it the state? Do you have your own insurance company now that the state provides, or do you hire other companies?
Well, all coverage is provided through HMOs. So there we have 6 HMOs throughout New Jersey. There's at least 2 in every single county. So families have a choice. So it's comprehensive health coverage. The package benefit is incredible. There's dental, there's vision, there's well visits, hospitalization.
So they get HMO coverage and the state pays for it.
Right. Now there is a sliding scale for families. Some families pay a very small premium, $15 per family. So it's not per child, it's per family. So, but that's for the higher income families.
What has been your experience so far with the cases that you've dealt with, Doctor, as far as people coming in?
Right. Basically, we're opening our offices to the community. We are also going into outreach, different locations throughout Hudson County itself, where we know that it's the second county in the state of New Jersey with the highest number of uninsured children, plus 4 out of every 5 individuals there is Hispanic.
So, I'm sorry, which one is the first?
Well, that's an interesting question. The first one, as far as I'm concerned, I believe is Cumberland County.
Cumberland County.
Cumberland County, yes.
With the most uninsured children.
With the most uninsured children, and then Hudson County has become the second. What we're trying to do is we're trying, like I said before, facilitate the information, making the parents aware that this is not welfare, that it's okay for you to qualify. Our philosophy is to have everyone register into the program. And it is up to the state of New Jersey to decide if you qualify or you don't qualify. We're facing issues such as immigration issues. People are afraid to qualify because although they have citizen-born children, they happen to be illegal aliens and they're afraid to apply.
So how do you get over that hurdle?
Explaining to the individual that the child is a USA citizen, explaining to the individual that New Jersey Kid Care is not an immigration program or is not being reported to immigration, explaining to the family in Spanish that they need to qualify because this is not welfare, this is New Jersey Kid Care, and that there is insurance for their children, which is uninsured. You know, this is important.
Barbara, how secure do you feel now, knowing that before you must have been worried that if something could happen to your son?
I was so worried. I mean, I happened to, in fact, I went to the emergency room, and there was a woman standing there, and she was Spanish, she was Latino, and she was asking about it in Spanish, and I knew she was saying New Jersey Kid Care, and there was no number. They didn't have a number. So I gave her my phone number, and she contacted me. I had a translator, and I gave the New Jersey Kid Care number to her. And I said, don't worry about it because they do have people who translate over the phone. You'll get help. So it worked out pretty well.
Well, good for you. But what happens? I mean, the Latino community, again, we do programs here all the time about how all these services are available to them. And the main problem we have in our community is that people are just not aware of the services that are available, the programs that are available. How do we get over that hurdle? In this case, it's something so important and so free and so valuable for the kids.
Well, the health issue is a big issue for our Hispanic community. This is what I see every single day. People coming to our offices, people calling our offices because they need to enroll their kids to school and they don't have health insurance for the physical exam. So health is a very, very big issue, and we Hispanics are playing a more important role in listening to what is available for health. We go to all these health expos.
I can't see any parent not wanting to give health care coverage to his child if he knew that the coverage was available. It's a question of just letting them know, because they're all going to come in if they know about it.
Right. And you would think it would be that easy, and that's what we thought. We thought we would build an insurance program and they would come. And we learned, 12 months later, that it doesn't happen that quickly. And I believe part of the problem is that issue of trust. Or do I qualify? Most of these parents are working families, so they never, they never had to associate themselves with government programs. So they don't think they qualify. I'm working, I own a car, I may have some money in the bank, so this program isn't for me. So it's really important for us, again, to partner with community organizations and non-traditional settings so that they can get the word out. Because it's interesting, our #1 referral is from friends and family. So that's how families have found out about our program.
Not from the person himself, but from a relative or a friend.
We've done a lot of mass mailings. So, and what we're doing is asking people, if you don't need this program for yourself,
pass it on.
Pass it on, because it's a great opportunity, and we don't want families to miss this opportunity. And like you said, what can be wrong with providing health insurance to children?
It's not only Latino, it's Americans, it's everybody.
It's everyone.
All right, because it is a predominantly Spanish area. It's good to get the word out to everybody.
You mentioned emergency room a little while ago, and I want to get to that because a lot of people in our community, in the Latino community, wait until it's really an emergency because they don't have insurance and they end up going to the emergency room, and that's how they get treated. How does Kid Care come into play in here? When they no longer have to do this, I imagine. They have prevention.
Yes, right. We're explaining to the families that Kid Care is a full insurance coverage where you have regular doctor visits, where you have immunization programs, where you even have dentistry. You can bring your kids for dental, and all these prevention programs, and also through the HMOs that the individual has a choice to pick up. If they already know of a doctor in that community that they want to go to, we can match that doctor with the HMO in New Jersey Kid Care. So we're trying to bring everything together to make it easier for the individual so they don't have to travel from one county to the other and they can stay with.
But doctor, do you find that some Latinos are actually fearful of insurance companies?
Yes, we are in a way because we don't know how to really get all the resources that the HMO is giving us, or we're afraid that if we use the HMO, then this huge bill is going to come after we visit the doctor. But then with New Jersey Kid Care, it's very self-explanatory that they have to pay a copay of $10, and everything that includes in that copay is included within the program, and they don't have to pay extra charges, including hospitalization and all the prevention services that.
Let's go over what is covered again briefly. Okay. You mentioned dental care is covered?
We have dental care, vision, prescription, hospitalization, obviously physician visits, well visits. We cover
So whatever medicine they need is also covered?
Right. Lab work. It's very comprehensive. Very comprehensive, and as Dr. Cardenas said, there are some small co-pays for some plans. Again, the program has 3 plans, A, B, and C. So the higher income families will pay small co-pays, and it amounts to maybe $5 for doctor visits, $10 for the UC emergency room. But for the most part, services are provided free of charge, and their premium is only for the high-end income family, $15 a month per family. It's real important to get that out. It's per family, not per child. The other thing I'd like to mention is New Jersey is very proud of the fact we're expanding coverage to another income group. We're going to go up to 350% of poverty. Right now we're at 200%. And in real numbers, a family of 4 now making almost $58,000 will be able to qualify for the program beginning July 1st. So we're going to, and we anticipate another 60,000 kids would be eligible for that. So we're, real
So the
proud.
window of opportunities is growing.
It's growing because, again, we want to go towards near universal coverage, and this is a great way to do it.
We need it.
So, and the other thing I'd like to mention is, we talked about community-based organizations. All healthcare providers are aware of this program. The whole state of New Jersey is very committed to making this work, and believe me, we're very dedicated to getting.
So any doctor in New Jersey, if a poor family comes in and they don't know about Kid Care, the doctor should know to tell them, hey, look, you check this program out, and then you can come to me, and it'll be covered? They know?
They know. Most, yes, I would say most, especially the pediatricians. We worked very closely with the Academy of American Pediatricians, all sorts of very traditional agencies. All the hospitals are on board working with us, referring uninsured families to our program. So everybody's working together.
I know you're working with Dr. Cardenas, but are you also working with other Hispanic community agencies in terms of because Dr. Cardenas, you're mostly based up in Hudson, Bergen County.
Right.
What about the south end of the state? Are there other Hispanic agencies that are also working on this as far as providing the services, or at least giving out the information on it?
Right. We work very closely with the Office of Minority Health, so they've helped us identify agencies throughout the state and we're working very closely with every agency that will talk to us, we will work with.
Doctor, tell us a little bit about La Salud Hispana. What is that all about? Because
La
that's what you're
Salud
hearing.
Hispana is a public health organization, and with this organization, we're reaching out to the Hispanic community with education and different outreach programs. One of the biggest programs that we have is the Hispanic Health Expos, where we have the opportunity not only to educate the Hispanic community and bring all these hundreds of informations to them, but also to provide services and screenings that otherwise Hispanics go by for years and years without knowing their cholesterol levels, without knowing what their glucose levels are in their blood, without having a vision test done to them. So this gives us an opportunity to tell them something is wrong with you, your cholesterol is high, and then we can refer them to a doctor in the community who can help them out. And also to give them information such as New Jersey Kid Care. Also with the Hispanic Health Expos, we're doing on-site registration. So we're trying to register the families there on-site to give them the opportunity to break all those barriers that otherwise sometimes we have. We don't want to go to the agency. We don't want to bring documents because we don't know what documents they're asking for. We're afraid to show them their income tax. Here at these health expos, we're gathering all this information and sending the application for processing. And finally, we have La Salud Hispana Health Magazine, which now has become a national magazine with the health information and the health prevention and the health awareness that we Latinos need to read in Spanish. This is a health magazine about health. This is not about beauty or how to get rid of fat or how to get rid of your wrinkles in your face. This is exclusively about health. What is diabetes and why are we dying from diabetes and why is diabetes #1 in the Hispanic community? That's exactly what La Salud Hispana is doing in public health.
Is NJ Kid Care part of a national movement? You said earlier, Ms. Walski, that it was dictated by some federal law. So are other states also mandated to do something like this?
Well, every state has the same unique opportunity to initiate a program. And actually all states have started.
Opportunity or requirement?
It's an opportunity. It's an opportunity. Not all states have to do it, but actually every state has submitted at least a plan to address this issue. So, but New Jersey was, I believe, the 10th state to actually get approval from the federal government. So we've moved, forward very, very quickly, which I think really gives you a sense of the urgency that we saw and how we wanted to address a very critical issue. I'd like to also add, talking about why families aren't coming forward so quickly, we feel that many of these families have healthy children. The kids don't have chronic illnesses or catastrophic illnesses. Pretty much they're healthy. So health insurance is not one of their top priorities. And we've got to start educating these families.
It's too late when the kid is sick.
It is too late, except then we get them at one of these other points of service so we can refer at that time. But it's important through the magazines, through the organizations, to let people know that it's out there, and it's a great way to get that preventative care, the vaccinations that kids need, and those ear infections checked out, so.
Doctor, in your dealing with other community organizations, other Latino community leaders, how many of them are aware of Kid Care, and how many,
well, do
you go out and tell them about it?
Exactly. Within the state of New Jersey, every single non-for-profit organization, whether they are African American or Hispanic or any other ethnic background, they are aware that New Jersey Kid Care is in existence. So I want to make that very clear. And we are forming coalitions to work with other organizations within Hudson County, within Passaic, within Essex, within Bergen County. We are working in coalition with other organizations so that we can address the issue together and register as many families as we can have access to.
Let me go back to the fear again, because there is a fear, not just in the Hispanic community, but everywhere now, because there have been a lot of negative reports about HMOs. And what you're offering is an HMO. I would argue with them HMO is better than nothing if they don't have anything. But how do you get over that hurdle of the fear of HMOs, the stigma that's been created around HMOs now?
Again, it's education. We have to educate the families that, HMOs is a way of life now. Many of us around this table, I'm sure, are in HMOs, right? And again, it's just talking to the families about the availability of service, how to access. You know, now that we have just giving the kids insurance doesn't mean we're going to have healthy children, but it increases their ability to access services. So not only do we have to get the word out about our program, how to use the services is very critical, and that's where education comes in again. And again, through organizations like La Salud, you know, we'll eliminate that fear, you know.
In the Hispanic community, the HMO, as far as I have seen it, is not a big issue because, believe me, the insurance is tremendously welcome for families, like I said before, that are in desperately need of health care access. And unfortunately, we don't have it. And many families come to us and say, you know, I have a sick child, what should I do? And sometimes the only thing we can tell this family is to go to an outpatient clinic of any of the local hospitals or to any of the local clinics so they can pay on a sliding scale. So it has been very, very well welcome to these Hispanic families because this is an opportunity to insure the children.
Very important thing we must do here is give out a phone number.
Please.
Because I'm sure everybody who's watching knows somebody who may need this, some kind of insurance coverage for their children. So please, what is the number where people can call New Jersey Kid Care?
Our toll-free number is 1-800-701-0710.
701-0710.
And we have multilingual operators.
Okay.
So people can call in and talk to someone about the program. We can pre-screen you over the phone, you ask a couple of questions, mail out an application, and we just need to get that word out.
So they mail you the application,
yes,
and you send them some kind of notice telling them whether they've qualified and whether they're covered, and then they get some kind of insurance ID, just like all of us who are insured.
Well, they have to pick their HMO. Once they're determined eligible, then they have to select an HMO. So within 30 days, we can get applications processed and children enrolled, as long as we have all the documentation. And
how difficult was that? How did you go through that, Barbara?
It was really no problem at all. I mean, they were very nice, and in fact, I wrote a very nice letter to them because it was so helpful. All right, so I had no problem whatsoever. And it was fast. I mean, I started, say, February '99, and I got my card. I had my card with me. I had it laminated and everything. That's it.
So see, you know, NJ Kid Care is making parents, like we can make parents feel like as happy as Barbara. You know, their kids are insured.
And my son is happy, too. He was worried.
But you know, families need assistance. We have actually over 500 enrollment sites throughout the state of New Jersey. And what that means is...
So when they call this number, you tell them where they can go
if they want to talk to someone. You know, if they feel, and a lot of people do feel.
Otherwise, they can do it over the phone.
They can do it over the phone, sure.
I also wanted to add quickly that La Salud Hispana has established a toll-free number, and the number is 1-888-2SALUD, TUSALUD. And with this number, any Hispanic family can call and inquire about the application, and we will send a coordinator, someone, an outreach worker, to go to that family's home and register them, or we welcome them to come to our office to register them.
The number, repeated again, it's 1-888-TU-SALUD, S-A-L-U-D.
Correct.
Which means your health, tu salud in Spanish. Okay, how important is prevention? Since you're giving all these kids insurance, and since obviously if they didn't have any insurance, they didn't have any prevention medicine available to them or forms of prevention, how important is that, doctor, and how often are Latinos unaware that they should take up preventive medicine?
Right. Unfortunately, with our Latino community, we don't go and see a doctor till we're very sick. So again, there is an issue with the education and the promotion and the awareness of good health. And one of the biggest barriers that we face is the fact that only 5% of the healthcare providers in the United States is Hispanic. We face the issue of the language. We face the issue of transportation. We face the financial issue that unfortunately many Hispanics have lost skilled jobs and they're not offered health insurance. And when it comes to the kids, it's even worse. So prevention is very, very important because by preventing, we can prevent from dying from diseases such as cancer and diabetes that is killing our community and the population in general. So prevention is very important. And by having access to health insurance is a way to prevent, because you can go to see the doctor once a year and have a total physical exam and get treatment for something that is going to happen to become worse.
What advice, if you're talking to parents out there who do not know if they're qualified or not, but are concerned about their children, and if you're talking to them right now, tell them tell them.
I would encourage them to call that 1-800 number immediately, and I would ask them, don't miss this opportunity. You know, here is a chance to provide health insurance for your kids. You may not need it right now, but there's nothing like being prepared, so it's really important. I mean, we want all of our kids to grow up healthy, and this is a great opportunity.
It's really a wonderful thing that the state and I guess the federal government, by mandating, has done for our children, and it's a form of socialism, I guess, but it's welcome socialism.
No, it's very good.
Because it's socialized medicine. I mean, finally, the low-income kids are getting the kind of coverage that we all deserve.
Right.
Instead of going to a hospital and not having anything and going to charity care, I mean, this is good for them. So, and it's on a sliding scale, which is great.
Well, I'm very happy that you were all here because it's very important that we get this message out, and hopefully because of this program, you're going to get a lot more calls from Latinos. And Doctor, for years I've known you, and you've been doing a wonderful job in our community, and I'm very glad that you were here today. Thank you for being on Images Imágenes, and we remind you to check us out at www.njlatinos.com. You can find out what's going on Images Imágenes there. I'll see you next week on another edition of Images Imágenes. Hasta pronto.